Dear colleagues, welcome to Infinite webinar series. This is the 21st webinar. This initiative creates opportunity for public health professionals to meet online and discuss public health and emergency issues affecting Eastern Mediterranean region and the globe. This initiative also creates coordination and networking opportunities between stakeholders, health professionals, and community. Today, we are going to talk about monkeypox, and it was thought to be rare and self-limiting disease, and this disease has not attracted much attention since its discovery 70 years ago. Recently, concerns has been raised about the emergence of monkeypox disease as well as it is a resemblance of its clinical presentation to the that of smallpox, the deadly disease globally eradicated by vaccination 40 years ago. During outbreaks, it has been challenging to clinically distinguish monkeypox and the chickenpox. Since May this year, cases of monkeypox has been reported from countries where the disease is not endemic and continue to be reported from several endemic countries. So as for now, all WHO regions have now reported cases of monkeypox. Last month, and mainly on the 21st of July, the International Health Regulation Emergency Committee met, and the question was to decide to declare the monkeypox outbreak as a public health emergency of international concern. And having considered the views of the committee members and advisors, as well as other factors in line with international health regulations for 2005, the Director General declared the outbreak as fake or public health emergency of international concern. And they issued temporary recommendations to stop transmission and bring the outbreak under control. So these temporary recommendations apply to different groups. The countries were classified to 4 groups, and based on their epidemiological situation, pattern of transmission, and capabilities. As for now, at any given point in time, many of these state parties will fall under group 1 and 2, and there are some countries that fall under group 3 and 4, and these groups are there, and their specifications and requirements will be discussed through our panelists today. So today, our webinar title will be Monkeypox and its implication on global health security. And today, webinar brought together a panel of subject matter experts to raise awareness about the disease, highlight the epidemiology of monkeypox cases around the world, and the implications of the disease and the rise of its importance on the global health security. The experts will highlight actions that should be taken to mitigate risk of further disease spread. Allow me to present our first panelist speaker, Dr. Ikhlas Hilat. She will be talking about the history of monkeypox and transmission from animal to human. Dr. Ikhlas Hilat is public health specialist, and she joined GHD Infinite since 2015. Her role is to implement the projects pertaining to zoonotic diseases, One Health, and laboratory-based surveillance. Dr. Ikhlas Hilat had 16 years of experience in the veterinary medicine field, and prior to joining Infinite, she was the head of Animal Health and Epidemiology Division at Jordan Ministry of Agriculture. She monitored the animal health situation disease surveillance, participated in preparing control strategies, contingency plans, and animal vaccination strategy in Jordan. Dr. Ikhlas worked also with international organization where she was national consultant with FAO, and she was also focal point with OIE, where she was responsible for the communication, notification, and reporting on animal health situation. Dr. Ikhlas also participated in mission of performance of service evaluation, BVS, and in the accreditation process of veterinary school at Jordan University of Science and Technology and for the Royal Veterinary College in London. Dr. Ikhlas Helat holds master degree in veterinary pathology and a bachelor degree of science in veterinary medicine from Jordan University for Science and Technology. Please allow me to welcome Dr. Ikhlas Helat. Dr. Ikhlas, the floor is yours.
Yes, thank you, Dr. Tariq. Good afternoon, all. Good afternoon for the panelists and for the attendees. I will start sharing my screen. Is it okay, Dr. Tariq?
No, not yet. No.
It is not. Yeah, then can you please share it from your side?
Sure, we'll share it now.
Yeah.
But please, can you tell us when you want us to go to the next slide?
Yeah, okay. Yes, good afternoon again, the panelists and the attendees. Today I will talk about the monkeypox in animals and the transmission to humans. Yeah, please, the next. First of all, I want to give a brief about zoonotic diseases. Just to remind us about the zoonotic diseases, that the diseases transmitted from animals, whether domestic, wild, and aquatic, to humans, and are public health threats worldwide. And there is another term called reverse zoonotic, when the disease is transmitted from a human to animals. And the most common example is the influenza H1N1 in pigs and COVID-19. The causative agent for zoonotic diseases could be viruses like rabies, highly pathogenic avian influenza, CCHF, Ebola, MERS-CoV, Rift Valley, COVID-19, and recently monkeypox. And also could be other causative agents like bacterial, vector-borne diseases, parasites, fungi, and unconventional agents like BSE. So please, next one. Here just I want to highlight that and focus more on the importance of the animal diseases and mainly zoonotic diseases, and mention that 60% of non-human infectious diseases originate in animals, and about 75% of emerging infectious diseases can pass or transmitted from animals to humans. And here also I want to focus on the weight of all vertebrate land animals on the earth. Nowadays, about 67% of livestock are waiting on the land, 32% humans, and just 1% wild animals. But this 1% wild animals, please on the next slide. The 1% of the wild animals causing about 71.8 or 23% of emerging and re-emerging diseases. So the wild animals or the wildlife is very, very important in causing and spreading the disease to the humans. And then if the virus or bacteria reach the human, the transmission will be from human to human, as happened in HIV, Ebola, H1N1, yellow fever, West Nile fever, Zika, SARS, COVID-19, and recently monkeypox. So what is monkeypox? Next slide, please. Monkeypox is a viral zoonotic disease caused by infection with monkeypox virus that occurs primarily in tropical rainforest areas of Central and West Africa. and it is occasionally exported to other regions outside of Africa, to Europe, and to US. Monkeypox virus belongs to the orthopox virus genus in the family Boxiviridae, and which include variola virus, which causes smallpox, vaccinia virus, which is used in the smallpox vaccine, and the cowpox virus. Next one, please. So for the history of the monkeypox, the first discovered case was in 1958 in Copenhagen, Denmark, when 2 outbreaks of pox-like disease occurred in colonies of monkeys. They were in the lab for research, and hence the name monkeypox. Then the first human case of monkeypox was recorded in 1970 in Congo. Next, please. Monkeypox is endemic or naturally occurring in countries from Central and Western Africa. So in these endemic countries, the monkeypox is thought to be maintained in nature through circulation among a number of susceptible mammals, namely the wild rodents, including squirrels, rats, and then occasionally spill over to non-human primates and humans. So what is the natural host for the monkeypox? It is believed that the rodents, most likely certain species of squirrels, rats found in the deep forested areas of the endemic countries, may be the natural host of the virus. Maybe there is more than these animals or rodents will be also the natural host. It is not yet determined which is the natural host. Yeah, please, the second one. Now we come to the non-endemic region. We are going outside Africa, and the most popular outbreak was in 2003, the first monkeypox outbreak outside Africa. It was in USA and was linked to contact with infected pet prairie dogs. It is not the normal dogs that we know, the carnivorous. It is prairie dogs, herbivorous, pet animals. And it was reared with giant pouched rats and dormice together. These animals were imported from Ghana, and in this outbreak, about 71 human cases of monkeypox reported or registered according to CDC. Most of the patients had been around prairie dogs, and specifically for this outbreak, the transmission from human to human not suspected. For that moment, it is from animal to human. Next one, please. Then between November 25 and November 207, a study found that the cases of Congo spiked to 20-fold compared with 1980s. And after that, there was a big or severe outbreak in Nigeria. And from that outbreak, travelers from Nigeria went outside Africa and spread the disease to Israel, UK, Singapore, and USA. What happened then? The virus take different curve and start transmitted from human to human. On July 23rd this year, WHO declared monkeypox as a public health emergency of international concern. So how it is transmitted, the monkeypox? The transmission of the monkeypox virus can occur when a person or susceptible animal comes into contact with the virus from an animal, human, or materials contaminated with the virus secretions. For example, the virus entered the body through skin lesions, even if it is not visible by naked eye, through also respiratory tract, through mucous membranes, and can be transmitted through direct inoculation by bites, scratches, direct contact with the body fluids, meat, maybe by direct contact or by eating the meat, the bush meat, undercooked meat, during hunting or during trapping. Next one, please. So we have primary and secondary transmission. The first one, or the primary transmission, it's from animal to animal or from animal to human through a scratch or biting or through eating the bush meat. Then when the virus reached the human, the virus started transmitted from one human to another, and we will see more details in the coming presentation about the humans. So can animals be affected? Yes. Rob squirrels, tree squirrels, cambium pouched rats, dormice, non-human primates, and others can be affected. And it's depend also on the route of transmission, the infectious dose. Some species are asymptomatic, especially those species related to the rodents, and other mammals such as monkeys and great apes show skin rashes similar to those happened in humans, like the picture. The next one, please. So far, there is no documented evidence of the transmission of monkeypox. What I mentioned before, the reverse zoonotic from a human to animal transmission, it is not documented so far. Also, the transmission of the virus to the domestic animals such as dogs and cats or the livestock, sheep and goats, it's not documented so far, but we have to take care. We don't guarantee the virus or any virus anymore. So we have to take care. The next, please. What to do when coming across suspected animal case? If there's suspected animal case, we have to ensure the good coordination, communication using a One Health approach between wildlife services, veterinary services, and public health services. Also using PPEs like gloves, mask, and disposable protective clothing, taking sample if possible, and after that testing these samples at the national lab, or if it is not available, the kits, we can test it in reference lab, notifying the OIE, the World Organization for Animal Health. Next, please. Then how we can reduce the potential risk of humans infecting animals? There is, as I mentioned, there is not documented records or study or research so far about the spillback, but there is a potential risk of spillback to susceptible animals. We have to take care. Collaboration and coordination between public health and veterinary authorities is very important. We have also to ensure that all waste, including medical waste, is disposed of in a safe manner, and that is not accessible to rodent and other scavengers animals. People who are suspected or confirmed to be infected with monkeypox virus should avoid close direct contact with animals. And I'm focusing here on the pets animals, the animals that are living with us in the same home. Next, please. So how can monkeypox virus be detected in animals? How we can make diagnosis in animals? It's mainly based on the clinical signs, but as I mentioned, not all animals show clinical signs, but the major clinical signs is increased temperature, appetite changes, conjunctivitis, coughing, sneezing, and the most important, if there is clinical signs, the skin lesions with or without pruritus, palpable lymph nodes will be enlarged, the lymph nodes. And for sure, if we can take samples, these samples, the best samples will be swabs from lesions, scabs, conjunctival swabs, and or oral and nasal secretions swabs, blood samples also, and these samples will be tested for ELISA, for PCR, and if it is applicable for virus neutralization test, but the most common test is the ELISA and the PCR. Yes, please. I want here to focus more on the globalization and the industrialization, and we also, not just us, the OIE or the World Organization for Animal Health, highlights that unregulated trade, including the wildlife animals or the wildlife meat and their products like skin or fur and other mammals, can lead to the international spread of disease such as monkeypox. So we have to take care more about the wildlife the meats, dairy products, and trading. The next, please. I will stop here and asking the same question that raised a few years ago. What is the disease X? Who stand between us and the next pandemic? What we are going to face? What are the lessons learned from COVID-19? Yani, is the world ready for next pandemic or disease X or coming diseases in the future? This is my question, and we can discuss more in the discussion part. So thank you so much. Thank you.
Thank you, Dr. Ikhlas, for this informative presentation. And for sure, and everybody knows that in the past decades, all outbreaks and pandemics that we have faced are of zoonotic origin. And I think it's my personal opinion is that the next outbreaks and the next problems that we are going to face we will be also related or attributed to zoonosis. Thank you, Dr. Ikhlas, again, and please post your questions to Dr. Ikhlas and to our panelists in the Q&A box, and we will, after the presentation, we will try to answer these questions online or privately, and if we don't have enough time, we will try to answer it via email. So our next speaker is Dr. Ziad Al-Khatib. He will be talking about the overview of the recent monkeypox outbreak. Dr. Ziad Al-Khatib is Associate Professor in Global Health at Karolinska Institute. Dr. Ziad Al-Khatib is Associate Professor and he is engaged in research concerned with infectious disease, non-communicable diseases, mobile health, and injuries. His research work includes injuries, non-communicable diseases, and infectious diseases. And moreover, he is teaching portfolio includes research methods, global health, mobile health, public health surveillance, infectious disease epidemiology, non-communicable diseases, and epidemiology of injuries. Dr. Ziad, the floor is yours, please.
Thank you very much. Good afternoon or good day and good evening, everyone, depends where you are in the world. Thank you for having me. I will be giving a small overview on the monkeypox as it is from an epidemiology point of view, as it's an evolving topic every day. So as my colleague mentioned, that this is not a new virus. It has a long history, this virus, that it has been in certain endemic areas, and now recently it did this jump to outside the endemic areas, and this is where it's creating all this discussion and this concern today, and also with the spreading that is happening, that we keep hearing every day about new cases, etc. So that's what also makes this webinar today very important. Thanks again for Mfnet for hosting it. So briefly, just a small reminder that about the two clades of the monkeypox, where we have the West African clade, and then we have the Central African clade, or known by the Congo Basin clade. And from what we know so far, that the human infections with the West African clade seems to have or less severe infections in comparison to the Central African one, or the Congo Basin clade. Also, when it comes to the fatality rate, it is much lower, the West African clade as well. So far, what we know, I will talk later about it regarding the which clade is the most common one. And I could see shortly in the chat before I started that Dr. Youssef had a question regarding the transmission and the mutations of the monkeypox. What we know that there was a study from Nigeria recently that showed that monkeypox is mutating quite fast, and kind of it's the nature of microorganisms or the viruses that to adapt to the environment that they have to mutate. Now, what it means in terms of the transmissibility, I think it's for time to tell. What we have seen with COVID, that it is gaining more every time we have a new variant. It is gaining more on the transmissibility and losing on other features of the virus. So with the monkeypox, I think it's for time to tell how the adaptation is happening. And of course, as you know, every day we have new cases around the world. And again, this map shows clearly why we have this concern today that we see more cases, and sometimes we see cases in the same area that are not linked to each other. So how they got infected and how we can do the contact tracing, that's where it's keeping everyone busy right now. When it comes to the phylogenetic analysis, so far I don't know if I can call it the good news, that the West African clade, which is less severe, quote unquote, in comparison to the Central African clade. So that's a question for another webinar, that why this clade in particular, why not this one? What does it mean for us when we trace it back? Who was the index case, etc.? So I think this is for time to tell, to be able to answer these questions. When it comes to the demographics of the reported populations of the monkeypox cases, so far what we know that the majority are adults, and the majority are males as well. And when it comes to the sexual orientation, almost all of them are reported to be men having sex with men. Well, this is at least among the population that they reported their sexual orientation. So far, we have around 16 countries. And again, this is another study where, sorry, this is the data here. It's from the ECDC WHO regional office for monkeypox, which is mainly inside Europe, but also other countries now, they are also reporting, uploading their data. And here, this is a cohort of a network among 16 countries that their paper came out recently in the New England Journal of Medicine, where also their data is confirming whatever ECDC and WHO have reported. And the all are men, with all of them report to be men having sex with men. And the travel history here, that's I would like to bring the attention of the audience to it, is that almost all of them, their travel history was inside Europe. So it's a virus that now is circulating regionally, I would say, and not across continents anymore. And only 9% of the cases they reported to have the smallpox. So it shows that this adult population who received the smallpox vaccine when they were born. Now, when it comes to the PCR isolation for the monkeypox from the samples, they took samples from different sites, but now there is an evolving or growing evidence about the availability of the monkeypox in seminal fluid. And this is here the reason I put this slide, because to just send one message that it does not mean that monkeypox is a sexually transmitted infection. It's still being claimed to be that it is skin-to-skin contact, and not even if it's available in the seminal fluid, it does not mean it's a sexually transmitted infection, because this is leading to a couple of misinformation around the monkeypox and how to prevent it. So it's very important that to position this health message in the public as well. Now, I will end my presentation with a couple of questions for the colleagues that to think about them for the future as well, how we, while moving forward with this topic, that what are the measures that are being taken in terms of the prevention to not to be transmitted to healthcare workers, and not to have this jump to women or pregnant women in particular and the children, and what does it mean if the monkeypox becomes an endemic disease in these not endemic areas, since now we see these transmission happening locally, and how the communication can prevent misinformation and stigma around monkeypox, because we see that history keep repeating itself. With COVID, we saw that there was a lot of conspiracy theories around COVID, and it's very important now with the monkeypox, we don't fall into the same trap of what happened with COVID-19. And should the monkeypox vaccine be scaled, what is the destiny of the low and middle income countries that, again, in terms of social justice and social equity globally around different countries in terms of access to these vaccines? Because again, we saw what happened also with the COVID-19 vaccine. And I think here I will leave the floor now for Dr. Islam, because he will be handling the vaccine topic. Thank you.
Thank you, Dr. Ziad, for very informative presentation, and thank you for bringing the question about, the misconceptions, maybe conspiracy that a little bit we are hearing something about it, and we have to be careful about it. We had the same mistake during COVID-19, and now we have to be careful about the conspiracy issues around the monkeypox. And our next panelist, Dr. Khawaja Mir Islam Saeed, he will be talking about the epidemiology and prevention of monkeypox. Dr. Khawaja Mir Islam Saeed is a recognized public health professional who has contributed to improving public health training in his home country of Afghanistan. Among his key achievements is designing and conducting 7 rounds of an intensive 6-week public health training, from which over 1,200 health workers graduated. His other achievements include the development of many guidelines, strategies, and policies within the Ministry of Health, of Public Health of Afghanistan. Furthermore, Dr. Saeed was one of the key figures who actively participated in the establishment of the Afghanistan Field Epidemiology Training Program. He is currently leading and managing the Afghanistan FETP program as a technical advisor. Dr. Mir Islam, the floor is yours.
Thank you. Thank you very much, Dr. Tariq, and thank you from speakers that made my job easy, because I'm the last presenter and many things have been covered. And for that, I will go through them or pass them. And I will take very limited time. Good day, good morning, good afternoon, good evening for our colleagues, wherever you are. I will talk about epidemiology and also a bit about the prevention and mostly about the vaccination of monkeypox. Monkeypox that's mentioned earlier, that's a salviatic viral zoonotic disease which is transmitted from animals to human and possibly from human to animals. Double-stranded DNA is susceptible to heat and disinfectant. Case fatality ratio, as mentioned earlier, it differs from 1% depends on the clades. Children are at higher risk when the pregnant women are infected. That is mainly to complications and even congenital monkeypox and also even stillbirth. Secondary attack rate for monkeypox is recorded to be 10%, although in some outbreaks in Democratic Republic of Congo it has been shown it is close to 50%. I will not go through its history, which is discussed earlier. This is also the reservoirs, which is there, mentioned by Dr. Ek. One thing that I want to mention here that WHO suggested on May that the name of monkeypox should be changed because the reservoir in the origin of the monkeypox is not very distinctly, I say that's monkeys. That's why the name they are suggesting should be changed, but it's not changed yet. This is the number of countries and just on reported the confirmed cases of monkeypox. It shows more than 28,000, close to 29,000 cases, 8 countries. That's 87 non-endemic countries and 81 in 7 endemic countries, 350. That's the thing which is reported in endemic countries, that's in non-endemic countries. Here if we see the trend of monkeypox, we see that it is rising, and the cumulative confirmed incidence of death and also the deaths. Fortunately, we can say that number of deaths is very low, and that is something that affects a global threat or not. The number of deaths due to monkeypox, that is now on 5th of August. Record, it shows 9, 3 are in Nigeria, and the other 6 are in other countries. Like the first death was reported in Brazil on 29 July. That was a 41-year-old man. On the same day, there was case in Spain. He was a middle-aged man also, which the cause of death was encephalitis. Spain reported on the 30th of July another report of death on 31-year-old man. In 31st of July, one that was reported in Ghana, and on the 1st August, one that was reported from India, 22 years old, and another in Peru. These are 9 deaths which are reported in 2022. Coming to the epidemiology of, in terms of age distribution, is what discussed. If you see the decades, on the first decade when after the median age was very low, even you can see less than 10 years. Gradually, it came to
Dr. Mir Islam, can you hear me?
Yes, please.
Yeah, can you switch off your camera, please? Because maybe the internet connection is not so good and we are losing your voice.
Okay, thank you. I will do that.
Yeah.
The transmission in portal of entry was discussed by our colleagues. I have just categorized them here. Human-to-human transmission is documented to be, chain of transmission has been 6th generation. After that one, the virus is not possible to transmit. When there is unprotected contact with respiratory droplets, with lesion materials, with body fluids, or contaminated materials such as fomites, in that case, the transmission will occur. The portal of entry is mostly respiratory tract, mucous membrane such as eyes, nose, mouth. In broken skin, which occurs when there's animal bites, when there are scratches. The other mode of transmission is vertical transmission from mother to fetus via placenta, and also recently, as discussed by Dr. Ziad, monkeypox virus was able to be isolated from semen samples. In that case, it raises a question that there is a possibility of a genital reservoir as well. Countermeasures which has been proposed, suggested, or implemented by different countries, agencies, experts. I have brought some of them here. For example, in some countries, enhanced surveillance has been focused, isolation of cases, and also management. Contact tracing and identification forward and backward, and also some emphasized on strengthening laboratories and diagnostic capacities. Infection prevention controls at the community setting and also hospital setting or clinical setting is focused and emphasized and implemented. Engagement with affected population groups and affected communication. That is emphasized that in order to avoid stigmatization and discrimination, better collaboration between human and animal health sectors. That's something which is emphasized in order to understand the impact of monkeypox on humans and animals. And also multi-country collaboration, that's another countermeasures which is required to be focused, and also vaccination. I will focus few slides on vaccination for monkeypox. Say that vaccination against smallpox is assumed to protect human monkeypox because they are very closely related to each other. They are related to orthopox, genus. It's attributed that waning the cross-protective immunity among households, those who have taken the vaccine before 1980, in 1980, eradication was announced and vaccination stopped. Probably that will be the reason for the monkeypox, because the gradually proportion of unvaccinated people has been reduced. Now, mass vaccination is neither suggested by experts, nor countries, nor agencies. Just they are emphasizing that vaccination should be given to those who are at higher risk. For example, US CDC recommends that persons investigating monkeypox outbreaks or involved in infected individuals should be vaccinated. And also persons who have close contact with individuals or animals who are confirmed, they should be vaccinated. And they are not, the CDC is not recommending pre-exposure vaccination for unexposed veterinarians, veterinary staff or animal officers if there is not involved with field investigation. As you know, smallpox, there was a question also, is containing vaccinia virus. And there are two types of vaccines for smallpox available. Now one is Jynneos and the other is. These two vaccines are developed for smallpox, which provide 85% effectiveness against smallpox. The protection level, this level is studied by smallpox in Africa. According to the CDC, vaccination with Jynneos or Imvanex is administered at 2 subcutaneous doses apart. And also with ACAM 2000, it is administered on 1 percutaneous dose with, in puncture technique with bifurcated needle. Anyway, ACAM 2000 is not recommended for potentially immunocompromised people because it has, potentially it will be replicating, but Jynneos is recommended for potentially immunocompromised people due to containing attenuated and non-replicating orthopox virus. UK health system also, they have started using Imvanex as a post-exposure prophylaxis in close contacts. In reaction to, current outbreak, many countries have started in order to purchase vaccines. For example, in May 2022, Spain, US, Germany, UK announced purchasing of, and also CDC's announcement of releasing the stockpiles for virus group. Bavaria and Nora, this is the only manufacturer of Jynneos in the world which is manufacturing the vaccine. They have closed in spring 2022, but it will resume the production on 2023, except for 50 million doses that just need in the final packaging. Another monkeypox vaccine, which is the modern LC16, that was developed in Japan as a national asset, but one state that could not assist other countries. Anyway, for like COVID-19, equity is very much important here in order to access and administration of vaccines to high-risk group. There are some questions or facts we can say that is it a global health security or not? I mean, you know, regarding the monkeypox. Cases are poorly or less linked to travel. And there are some changes in the clinical features of the current as compared to the previous ones. And as we discussed earlier in the other presentation, 99% of cases in the endemic region, non-endemic region, Africa, they are in men. 98% are occurring in the community of, men who have sex with men or bisexual. This is something that we should focus when we are saying global health security. Mathematical models shows, even WHO in July 2022 says, the reproductive number is 1.29. That is more than one in communities, high-risk communities, and less than one in other communities. As you compare it with the smallpox, which was 3.5 up to 6. This is something that we can say, pose a question that is it a global health security for the future or not? The virus has lower contagiousness, and also if the person is infected, there are high doses needed in order to infect and make the person sick. There's another issue regarding weaponization of monkeypox. It will raise the questions to whether or not it would constitute similar to, variola or monkeypox, which is taken in the laboratories in order to not be used as a weapon in the future. These are again, shows the high-risk communities, those who are exposed or who are transmitted. Highest proportion are in specific communities. Here, I would like to focus on some advices of international health regulation, emergency committee, which was provided, and they have categorized the countries into 4 groups. And for each group, there is a set of recommendations to be implemented in order to avoid, in order to prevent ensure global health security and prevent the. For group 1, these are the countries which have not, sustained, there is no imported case, or even you can say there is no human-to-human transmission. They should establish coordination mechanism for preparedness and response. They should plan to struggle against stigmatization and discrimination already. They should establish and enhance surveillance and laboratory diagnostics. They should intensify case definitions, case detections by training and capacity building of their health workers. And they should raise awareness about monkeypox, their transmission, their related prevention and protective measures among the community, especially among high-risk groups. They should engage key community-based groups, sexual health and civil society networks, and others to increase provision of reliable and factual information. They should focus on risk communication and community support efforts, on settings and also on venues where intimate close contacts will take place. These countries are also emphasized to immediately report to WHO through channels, that's IHR focal points, when there are any cases suspected or confirmed cases. Not suspected, probable or confirmed cases are occurring. These are a set of recommendations that you can go to the document itself and see the details of these recommendations for group 1 countries. IHR advice for group 2 countries. These are the countries they have imported cases of human-to-human transmission occurs. They should implement coordinated response. And that just means you implement response action. Priority focus should be communities which are at high-risk group. They should empower affected communities and enable them to support their leadership, basically to engage these high-risk communities. They should implement response actions with the goal of protecting vulnerable groups. These are sub-recommendations which are related to implementing coordinated measures. For engaging and protecting communities, they also have some group of sub-recommendations, like they are saying these group 2 countries should raise awareness about monkeypox virus transmission. They should engage with organizers when there is gathering of big events. They should try to, ensure or promote personal protection measures and behaviors, reducing risky behaviors. They should develop targets, risk communication, and community engagement interventions. For each of these categories, there are subcategory recommendations. For example, for surveillance and public health measures, there is a set of 10 recommendations and more than that. For clinical management and infection prevention control, there is also a set of recommendations. For medical countermeasures and research, for international travelers who should travel, if there is no need, those who are confirmed or those who have contact, they should not travel, even if there is a dire need. And that need is also explained in the recommendations. In group 3 countries, there is also advice. These are the countries you can say already the endemic countries or animal to human transmission occurs. They say that they should establish, if that is established, they should activate collaboration of One Health coordination. This is a mechanism should be there at the national, provincial, local levels. Relevant health sectors, non-health sectors should be in this coordination mechanism. Veterinary, environment, wildlife authorities. This should have a coordination mechanism in order to respond. This mechanism will work for understanding, monitoring, and managing the risk of animal to human or human to animal transmission in natural habitats. And also, they should undertake detailed case investigation, and they should do some studies to characterize the transmission patterns. If there is some changes in transmission, they should inform the international community, including suspected or documented spillover from animals to human or a spillback from humans to animal, which is not recorded. The group 4 countries, these are the countries which are manufacturing the vaccines, the diagnostics, the therapeutics. There is a couple of recommendations from IHR emergency committee to them as well. They are saying, state parties who have manufacturing capacity for smallpox and monkeypox diagnostics, vaccines or therapeutics. They should raise their production and availability of medical countermeasures. And also, these state parties and manufacturers should work with WHO to ensure diagnostics, vaccines, and therapeutics and other necessary supplies are made available based on the public health needs. It means, they are focusing on equity, solidarity, and at reasonable cost to countries where they are most needed in order to support and stop the onward spread of monkeypox. This is my last slide. Thank you very much.
Thank you, Dr. Mir Islam. Thanks to all our panelists for today. Please post your question in the Q&A box. And if you allow me, let's try to answer of some of these questions. Thank you for answering that you answered many of these questions. But if you allow me to start with a question of cross immunity, and if people who were vaccinated against the smallpox, and I think that was more than 40 years ago, can have some immunity against the monkeypox. I think many of these questions were raised when the outbreak started. So please, who will be answering? Please, Dr. Ziad, Dr. Mir Islam, about the monkeypox and smallpox vaccine and cross immunity.
Thank you very much. Thank you. As I mentioned, in 1980, he is right, when the eradication was announced and the vaccination against stopped. And now, if you are, born before 1980, you are lucky enough in order to are protected from smallpox. Because monkeypox, smallpox, and also cowpox, camelpox, lots of pox viruses are cross-protected by vaccines which were given in that time by for smallpox, because that was produced to cover the orthopox genus. And based on a study which was there in 1980 in African countries, it showed that there is 85% protection those who have taken the smallpox virus, they will be protected. Cross protection will be there for this, but another 15% is there, as you showed by Dr. Ziad mentioned. There was a person who has taken a group of people, maybe they have been vaccinated by smallpox, but still they have taken they have been infected with monkeypox. Meaning, this is something more studies, more, research are needed in order to do that. The current vaccines which are available, this was developed, meaning that there will be some, accidental release of monkeypox, and they should be ready. But now, many countries, like as I mentioned in Japan, and many countries have been started to develop vaccines, and WHO is also supporting and encouraging those manufacturers in order to have the vaccines to be available. But there was some question that what is your message for the public? What we are seeing right now, that it is that the contagiousness of this one is very low. We cannot say that it's high contagious. The reproductive number is less than 1 for general community. That's why, based on epidemiologically and based on mathematical model, we can say that that's very difficult for monkeypox to be a pandemic in the future. A concern, but still, as a public practitioner, we should think we should be vigilant enough in order to protect the people, the community, and this should work for that one. And currently, this is not new. Vaccinations are available. We can use those vaccines in order to cross protection until the specific vaccine is developed. Thank you.
Yes, thank you, Dr. Mir Islam. So, if you allow me, let me put this unanswered question. So, is it accurate? And I think Dr. Ziad tried to answer it online. Is it accurate to call monkeypox an STD and only?
You are opening the Pandora box.
Yeah, this is as it's written in the publications. So we have about 97% of MSM cases, but still we have this 5% where some cases were infected by another routes of infection. But still, can you elaborate more? And do we have to be careful when we decide to call it an STD?
Is this question for me?
Yes.
So the thing is that when, to consider it as sexually transmitted disease, then there is a concern whether the public, they will assume by using condom, for example, you can prevent the transmission, like with the HIV. And that's why right now there is no evidence that whether the monkeypox virus is actually being really transmitted through the seminal fluid, or is because of the skin contact with the lesions pockets that this transmission is happening there.
Yeah.
That's why it's still a gray zone. So of course, along the way, when there is more data when it's published, we will be able to really clarify this thin line.
Yeah.
But so far, from what we know about this virus, from the past, we haven't seen such data. So that's why now this area of nomenclature, how to call it, it's being really treated with a lot of caution as a public health message.
Yeah. Yes, thank you, Dr. Ziad. So let me go to another question. Coming back to the zoonotic diseases and emergence and re-emergence of these diseases, and as they are a public health threat. And again, if we want to talk and advocate for public health, One Health approach as a priority to be applied at the country level. So how do you see Eastern Mediterranean region readiness? And I think this is addressed to Dr. Ikhlas maybe, and please feel free, Dr. Islam and Dr. Ziad, to elaborate more. Dr. Ikhlas?
Yes, thank you, Dr. Tariq. I think the only solution for zoonotic diseases and such diseases like COVID and monkeypox is the One Health approach. And we, not just at EMR, globally, the One Health framework is the only solution. If there is no collaboration and coordination between the sectors, it will not be resolved. And also, I saw one of the questions about the containment of the monkeypox. What we want from the One Health approach is not just to resolve the problems or to act with the problems. We want to prepare and to prevent it. We want to contain the disease on the animal population before it reaches the human. So if we are succeeding in this, containing the diseases and the viruses and keep it on the animal part, it will not reach the human. So we need more actions, more work, more preparation for this, for the more work on the animal health itself with coordination and collaboration with other health sectors. So I think the One Health approach is the only solution for this, for such diseases. But are we prepared for that? All of us know the answer. We are trying to be prepared and to train the whole health professionals, even to take care and to know the importance of the One Health approach in such diseases and pandemics. We want to contain and keep the virus on the animal side, treat it there, control it there before it reach or touch the first human case. After that, the problem become like pandemic, and WHO will consider it as international public health of concern, and I think then it will be very difficult to deal with it.
Thank you, Dr. Ikhlas. Dr. Mir Islam, Dr. Ziad, do you want to add more?
Yeah, thank you. Thank you from Dr. Ikhlas. Basically, in the Eastern Mediterranean region, we are different from other countries a bit. If you see in those countries which is already imported in the Emro region, like UAE, like Qatar, Saudi Arabia, and Morocco, the imported cases are there. Even from UAE, there was imported cases to India, which was died, in August. We have, in our region, we have some other problems, which is not there in other regions. Like, we have conflicts here. We have disasters here. We have weak health system here in our region. If we name the countries like Afghanistan, like Pakistan, like Syria, like Iraq, these are countries they have facing with complexity of emergencies. And that's a bit difficult for these countries to get prepared for. And it was shown by, for COVID-19 as well. Anyway, there's a need for WHO region and the EMRO, and also for UN agencies and other health partners like INFNET and other networks in order to work with these countries in order to get prepared for. And hopefully, they have taken the experience from COVID-19, and the settings are already there, and they can just strengthen. The resources will be needed, the support will be needed for these countries because they require technical capacity and financial. Thank you.
Thank you, Dr. Mir Islam. So I think by towards the end of your answer, you have said something about the possibility, and if we are ready and based on our experience with COVID-19, if the monkeypox now it's a public health emergency of international concern, if it can be contained. Do we have all necessary, tool system preparedness mechanism. Can we judge now about that, or it's a little bit early? So it's like a general question for the, containment of the disease. Please feel free to say, to answer, to elaborate more. Dr. Ziad, Dr. Mir Islam, Dr. Ikhlas.
I think the first step in the containment here is to ensure that the public is well informed and to have the proper information to the public, and also the healthcare workers to be also equipped with information and tools in terms of someone shows any symptoms, they need to be treated, and there is no stigma for them when they come to seek help from the healthcare system. So I think this will be the first step, really, to be able to make sure that we know who is being infected, and once they want to seek help, that the help is there, they know where to go to.
Thank you, Dr. Ziad. So another question, and it's here directed to Dr. Mir Islam, about vaccination of immunocompromised persons. And is it recommended to vaccinate, and because of the type of the vaccine, because it contains attenuated virus? So, Dr. Mir Islam, can you say more about that?
Thank you. Thank you very much. There was another question, in the Q&A. They were asking, is it needed to have another smallpox vaccine if we are already vaccinated?
Okay.
I think that, according to the CDC, they are saying, the smallpox, when they are vaccinated, it will be the highest level of immunity will be after 3 to 5 years. Then after that, 95% protection will be given by this smallpox vaccine. Even the smallpox, there is 5% possibility of being infected again, and 85% for other monkeypox. And gradually after 5 years, the immunity will be decreasing. That's why they are saying waning the immunity status probably is the reason for infecting the monkeypox. Those who are already vaccinated, they will be, infected due to that one. For that case, if smallpox or even under the monkeypox, in that case, a booster dose is also needed. Those who have taken already the smallpox as well, if they want to be protected against, smallpox or against the monkeypox, they want to protect this one. And another regarding the immunocompromised people, as you know, they are vulnerable already to the monkeypox, to other diseases. That's why CDC recommends that these groups should be vaccinated. If they are at risk, immunocompromised people, those who are already there, the listed category is there. If they are at risk of getting the monkeypox, they should be vaccinated, but the type of vaccine is very much important. There are 2 vaccines available, which is, the Invanex, and also the other is the ACAM 2000. The ACAM 2000, that's a replicating one. These are attenuated, but replicating one, that's possible when there's immunocompromised. This is a possibility probably that it will, worse the situation. That's why this vaccine is not recommended for them. But Giant is recommended because that's not a non-replicating attenuated vaccine. Thank you. Over.
Thank you, Dr. Mir Islam. Thank you so much. Do you want to add anything, Dr. Ziad, Dr. Ikhlas, to Dr. Mir Islam answer? So we have another, Dr. Ziad, please.
Oh, no, I just want to say no, thank you.
Yeah, thank you. So another question, is there any evidence or studies of any association, either negative or positive, between monkeypox infection and post-COVID-19 or the vaccine? So please, actually, myself, I don't know what to answer here, but if you, Dr. Mir Islam or Dr. Ziad.
Thank you. I will say something, then Dr. Ziad will add. we should acknowledge that there is uncertainties. We should acknowledge the complexities of what, I mean, you know, this is PGIC, the monkeypox, at the same time the COVID-19 is a pandemic. Still, there is lots of unknown as compared to knowns. For COVID-19, at the same time, for even monkeypox is already, we know a lot about that, but lots of uncertainties already there because there is change in the clinical profile. Now you can see that there is change in those who are infected just in the specific communities. That's why, I mean, you know, still there is no study. I have not seen the evidence or the studies as post-COVID-19 relationship with monkeypox. I mean, you know, if that was available, we will share. Thank you.
Yes, thank you. Dr. Ziad?
Yes, please. So this question, I think it's being raised because there has been a famous misinformation blogger from North America who has been propagating this message.
Yeah.
And again, when we learn from history, from HIV, for example, one of the biggest setbacks in the history of HIV from the past, that people were spreading information that HIV does not cause AIDS. And this has unfortunately caused many people living with HIV to somehow convince them that they should not receive antiretroviral therapy, which it ended up sadly costing their life to die early. And now this issue about monkeypox post-COVID-19 vaccination is being known in the social media because of this blogger who is about misinformation spreader.
Yeah,
so
thank
I
you.
think for public health colleagues, it's an area, unfortunately, that few of us are working on it, how we can spread correct information. So if we can learn from the viruses, how the viruses are being transmitted so fast, that's why they say a message goes viral, a tweet goes viral. How can we really spread the correct information in a viral way? Yeah, it's an enigma for me, to be honest, that I would love to learn more about it.
Thank you, Dr. Ziad. Thank you, Dr. Ziad. I think many of also important questions were answered online. Again, there are many unanswered questions. We need to know more. We need to see more. My positive look at that is that the world or the public health professionals or systems moved rapidly because of their experience to COVID-19 pandemic. So all surveillance systems were activated to detect cases of monkeypox in most of the countries based on the lesson learned from COVID-19. Again, as Dr. Ziad mentioned, we have to be careful from, any misconceptions and conspiracy issues or messages that may come or are ready to come out to the communities. With that, I will stop and I will ask our panelists to say a few words, the general messages about our today's talk about the topic. It's important. We still need, as I mentioned, more to learn, more to gain more information about this disease. So please, our panelists, Dr. Ikhlas, to start with your final messages to our audience.
Yes. Thank you, Dr. Tariq. I think we have to take care more about our pets. And if there is suspected cases of monkeypox, human case, to be far away from his or her pets, avoid kissing and hugging of the pets. And there's another things about the prairie dogs. They are very, very nice, very very beautiful bits. So some countries banned the importation of these bits. So we have to take care in importation, exportation of these animals, even if we want to use it in the research lab. There is a vaccine, we can vaccinate these animals before doing any test in the lab. The same vaccine, the smallpox one, the vaccinia, can be used for monkeys and can be used for these pre-dogs. So just to take care and be far away from our pets if there is suspected case. And as you know, the general hygienic measures, and we have to work more on the One Health. This is one of the strategies for Infinite, and I think we are in a good shape in One Health and Infinite. We have to do more and to collaborate with other sectors to control, as I mentioned, the disease from its origin before it going to the human side. And after that, the problem become more and more huge. So that's it.
Thank you, Dr. Ikhlas. Dr. Mir Islam, please.
Thank you very much. Following Dr. Ikhlas, I want to link my conclusion that she was explaining about the One Health approach. And this is something that I would like to emphasize on this issue. And, you know, it should be focused more as compared to previous agendas. The diseases that she was explaining, that 60% of diseases are originated in animals and if 25% are transmissible. And at the end, she was saying, you know, what is the disease X? I mean, that probably 95% maybe that, I mean, animal origin. That's why the UN agencies, the partners, donors, the countries should focus more on One Health approach. Now, I mean, you know, the environment, the wildlife, the animal sector, and also the human health. They should hand to each other in order to stop and to prevent the current one and also stop the futures. Regarding the monkeypox, I mean, you know, shift of burden, to my opinion, mostly goes to communities. If in the governments, the hospitals, the clinics, the health centers, the health workers, they can do their own works, but I mean, you know, it will be stopped when the community are taking actions. If, I mean, very easy, if they are, I mean, washing their hands, if they are taking the very simple measures, possibly will prevent and stop lots of, I mean, you know, diseases, including the monkeypox. I mean, this is something that we should get ensured that we are taking the preventive measures, including hand washing, including using the mask, including hygiene. These are something in the community, if they are fully aware, if they are literate, healthy literate, in that case, that's very highly possible that we stop the disease from the scratch in order to prevent the onward transmission. Thank you.
Thank you, Dr. Mir Islam. Dr. Ziad, please.
I think for me that I see more discussion happening whether airports, they should do any filtering to select cases. And I think we have learned a lot about COVID-19, that all these testing at airports, maybe they were not really needed once the virus is being locally transmitted. And it has created a lot of discrimination and stigmas around airports and airplanes and nationalities. And I think as humanity is one, so we need to really think about an approach, more a global approach, that every country is, we are all kind of one country, you know, it's just that there are political borders. So I think with the monkeypox, we shouldn't really try to redo whatever we try to do with COVID, and also to see how can we change the approach for such infectious diseases, especially that populations are growing. The more we have urbanization, the more we are in touch with microorganisms. For me as an epidemiologist, it's not about if a disease will happen, it's just when it's going to happen.
Yes.
When we are going to touch more the nature and we will try to invade their environment, and how we can live together in a kind of peaceful way.
Yeah.
So just that for the colleagues in working in public health and really how we can have this discourse, public discourse, more often about how we can help each other. So whenever, if there is a neighbor who has any problem, I don't shut the door in the face of my neighbor, but how can I reach out to my neighbor and help? So I think with the monkeypox, this is the question that I will leave the audience with. Thank you.
Thank you, Dr. Ziad. Please allow me to thank our speakers today. It was very excellent, informative presentations, questions, and discussions. Again, we still need more time to know, and I strongly suggest to have another session with more updates, maybe within a few months. Maybe we will have more information about the disease, containment of the disease, and surveillance activities all over the world. Maybe by that time, the decision will be taken about, the nature of the disease and whether it is an STD or not, and maybe research articles or research experiments will come out and give us more information. Thank you, colleagues, panelists, for your time today, for your contribution to this webinar, and I would like to thank also our attendees for their time being with us. And with that, I will conclude our webinar today, and looking forward to see you again on our next webinar. Thank you, and wish you all a lovely evening and best wishes.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Thank you.